The union representing Ohio nurses is sounding the alarm about difficult workplace conditions.
NBC4 State House reporter Jesse Bethea heard from lawmakers today about how they're going to address Ohio's nursing crisis. Jesse?
Thanks, Jared, and thanks, Jen. A new survey shows an overwhelming majority of Ohio nurses report chronic and dangerous understaffing at the workplace. And lawmakers tell me this is coming at a time when Ohio needs nurses more than ever. According to the Ohio Nurses Association, more than 91% of the state's nurses say their workplaces are consistently staffed at unsafe levels. Kelly Hikes says the problem is not necessarily a nursing shortage.
We have plenty of licensed professionals in the state of Ohio to fulfill the needs that we have. We do not have plenty of people that are willing to work under the conditions that we have right now.
According to that same survey, almost 70% of Ohio's nurses say they've experienced some form of workplace violence in the last year. Representative Crystal Lett says the threat of such violence, combined with staffing levels, is driving people away from the profession at a time when Ohio needs more nurses.
As we have an aging population, mental health is not improving. We're seeing it flatline, in some cases becoming worse, especially for kids. This is not a moment where we can go without nurses.
Lett, along with Representative Christine Cockley, talked with nurses today about their bill to require hospitals to adopt specific nurse-to-patient ratios appropriate for every hospital unit. They say that would ensure a manageable workload and prevent burnout.
If a nurse shows up and they are stretched thin because there's too many clients and not enough staff or nurses, if they're not getting the support that they need, it then is going to negatively impact the patients, and it becomes a safety issue for everybody.
Representative Brian Loren spoke about his bill to give nurses more of a say in hospital staffing decisions. He says the state needs to define what should count as an emergency, warranting a disruption of appropriate hospital staffing.
Let's have some validity around what's an emergency. Was COVID an emergency? Sure. Is a snow day an emergency? Maybe not. Let's have some regularly agreed upon standards that